Well, good morning. I'd never been to Cleveland before, and I don't know why. I'm serious. It's a really. I had a tour yesterday. Najeeba took me around yesterday, showed me East Cleveland, showed me Shaker Heights and Cleveland Heights, and down by the waterfront with those incredible mansions and whatnot. And I thought, wow, this is kind of a really thriving community. I had been to Detroit. At one point I was offered the Director of Health position in the city of Detroit, and I considered it until my wife at the time said, no way, because it was between San Francisco and Detroit. But I didn't know very much about the sort of the industrial Midwest. And Cleveland seems to me that, my impression was that Cleveland has a lot of social capital, meaning that people really sort of feel bonded here, and generations and families stay here for a reason, because they feel like it's home. And that's really important in this work. So I'm kind of excited to work with the Cuyahoga County Department of Public Health and others. And you'll see that we are collaborating on some stuff. I'm a big data junkie, as they say. And we're collaborating around some data analyses that I think are actually quite important to driving this work. But I've been to a lot of places talking about this kind of thing, and I've come to acquire the ability to sense when there's real potential in a place where people are really committed to working together. And it's clear to me that in Cleveland that is the case. And so I'm very excited about being here. You've got great leadership, you've got real community engagement, and you've got multidisciplinary, multi-sectoral interest in partnering together. Hearing from the planning director and the health director, and recognizing that they are both speaking the same language and they both have the enthusiasm for working together, I think is a huge asset that you don't have in that many other communities. Anyhow, I hope this is the right presentation because it says September 16th, but I think that I was confused last night when I was editing it and got the date wrong, but maybe I got the date right and this is the wrong presentation. We'll see. Okay, so keep going. Hit it like 3 times. You're going to be doing a lot of work today. Okay. No, that's too many times. All right, so I like to make my message simple because I'm a simple person. And it's important, I think, in this work to be very clear about what you're saying. I'm a public health practitioner, very proud of it. And I want to recognize Matt Stefanik in the back, who's a good friend of mine from NACHO, and another local health director from Ohio. And what we do is we spend our days, and oftentimes our nights and weekends, trying to figure out how to make our populations healthier. And when you do that for a while, you start to pick up cues about what your community is telling you. I have 1.5 million people in Alameda County, and I'm going to show you where that is in a minute, roughly the same size as Cuyahoga County. And I like to say that my patient has 1.5 million hearts. But the other thing my patient has is 3 million eyes. And you can tell a lot about the health of a community and a neighborhood by looking in the eyes of children. And so when you look in the eyes of these children, you see health. It just speaks health to you. It speaks opportunity. It speaks hope. Hit it again. And one more time. These children tell you something a little bit different. And just try this. Walk around your community and look in the eyes of children. Just do it. And it'll tell you everything you need to know about that community. Kids don't lie. And they tell you when they feel devalued. And they tell you when they sense a lack of opportunity. And that is enough for you to make an assessment. I'm going to show you a lot of data and maps later, but you can throw all that out. Just look in the eyes of children. Next slide. This is the other takeaway message, which is 6 boxes, which is, as I say, I'm a simple person. I need to understand what I'm doing at all times. And this framework helps me do that, because when I first got to public health, I didn't really have I'm a doctor, I practice internal medicine. I didn't have a great sense of what public health was doing. It seemed like a lot of activity, but I didn't get a great sense of what that activity was directed towards. So we put together this framework to try to understand what it is that we are doing and how it fits together with what we claim are our goals in public health. Next slide. Okay, for the non-public health people, and perhaps for some of the public health people, we have a Bible in public health. It's called Healthy People. It started in, I don't know, maybe it started in 1980, but there was a Healthy People 1990, Healthy People 2000, Healthy People 2010, and now we're working on Healthy People 2020. Each decade, we set a bunch of goals. Then when we reached the end of the decade, we recognized that we didn't achieve any of those goals, so we set another set of higher goals. Healthy People 2010 was a change from Healthy People 2000 insofar as it changed some of the emphasis around the issue of health disparities. I'm going to explain that to you in a second. But the first goal of Healthy People 2010, and it's a laudable goal and nobody disagrees with it, is to increase life expectancy for all and to increase the quality of life for folks. And that seems like a pretty good goal. And in Cuyahoga County, you've got 1.4 million people. The goal there is to increase the life expectancy in that population and to increase the quality of life. The second goal is to eliminate health disparities. And I underline the word eliminate because it used to say reduce in Healthy People 2000, and eliminating and reducing are different tasks. So what I hope to do is outline a practice that's actually targeted, as Martha spoke to the root causes of health disparities, because if you want to eliminate them, you've got to figure out what's generating them. And if you don't understand what's generating them, then you have no chance of eliminating them. You're just going to constantly be managing them and maybe reducing them on occasion, but not in a sustainable way. Next slide. Okay, so health disparities, very quickly, this is a definition that I actually despise. Are differences in the incidence, prevalence, mortality, and burden of diseases and other adverse health conditions, hit it again, that exists among specific population groups in the United States. That's from the National Institutes of Health, sort of our overlords in public health. And the problem with this definition is that it gives you absolutely zero context. It basically just lays it out there that these health disparities exist. And I told this joke yesterday, and it's true that, you know, on my way to work the other day, something darted out in front of me, startled me. And a friend I was walking with said, you know, what's wrong with you? And I said, something just scared me. And he said, oh, that was a health disparity. They exist. They're out there. Just be careful. And that doesn't help me that they exist. It doesn't guide me to any kind of approach to trying to eliminate them. It just says that they're there. It's just like saying, you know, global warming exists, or, you know, poverty exists. Help me understand sort of how it's generated. Next slide. Health Canada uses a slightly different concept. They refer to this concept of inequities, which are material, social, gender, racial, income, and other social and economic inequalities, and this is the important part, that are beyond the control of individuals and are therefore considered unfair and unjust. So they immediately go to this notion of outside the control of individuals, not specifically related to individual behavior or individual choice, and that there's a justice element to it. These are unjust inequities. And then the World Health Organization takes the concept of health inequities and defines them as differences in health status and mortality rates across population groups that are systemic, avoidable, unfair, and unjust. So everywhere else in the world, we speak about these things in the context outside of individual behavior. But in the United States, they exist. And people, for some reason, just decide that they want to engage in disparities. It's a very unhelpful approach to the concept of what it is that we're trying to eliminate. Next slide.